Hello, my name is Joanna Schreck, currently attending Ball State University in the course SPCE682. This presentation was made on February 18, 2024. This presentation is on diversity. There are various factors and barriers that can affect the services one provides, from diagnosis to treatment and outcomes. The objective of this presentation is to understand culture competence, inform staff who work with individuals or families affected by autism spectrum disorder, about diversity and family factors. This includes bilingual families, urban versus rural populations, socioeconomic status, and military families. After reviewing each factor, one will be able to identify guidelines for how to best work with these families in a clinic or school setting. Let's talk about culture competence. Culture competence is defined as involving understanding and appropriately responding to the combination of cultural variables and the range of dimensions of diversity that the professional and client and family bring to interactions. This definition is important because we are not only focused on understanding the client's and family's culture, but also our own. Culture includes categories like race, sex, gender, sexual orientation, socioeconomic status, religion, age, and ability and disability. This is key in ASD diagnosis and treatment. Ethics Code 1.07, Cultural Responsiveness and Diversity, states that behavior analysts actively engage in professional development activities to acquire knowledge and skills related to cultural responsiveness and diversity. They evaluate their own biases and ability to address the needs of individuals with diverse needs and backgrounds. Behavior analysts also evaluate bias of their supervisees and trainees, as well as their ability to address the needs of individuals with diversity needs and backgrounds. There are steps one can take to increase their cultural competence. Cultural awareness is the ability to understand one's own culture, to understand the unique perspective and biases one brings to the interaction. One way you can identify your cultural awareness is to take online assessment quizzes. Culture knowledge is critical because it will help respond appropriately during clinical interactions. Having knowledge about their beliefs and cultural norms or their manners will help have a better interaction with the family. Bilingual families. According to the article by Rayman and Rado, an estimate 23% of U.S. children are raised in a home where a language other than English is spoken, and approximately 1/4 of autistic children in the United States are raised in homes where 2 or more languages are spoken, meaning that 1/4 of children of autistic children speak 2 or more languages, and it is our job to be able to accommodate the family needs. Bilingual families are often advised to raise their child as a monolingual, despite numerous evidence of non-cognitive differences between monolingual and bilingual children shown across studies of typical developing children and children with autism spectrum disorder. Given the growing number of heritage language speakers in the United States, this lack of culturally informed ASD research reflects a critical oversight. Treatment decisions are often made based on availability of personnel rather than a child's needs. A shortage of bilingual professionals translates to an environmental that discourages bilingualism out of inaccessibility rather than empirical evidence. One of the obstacles in bilingual families is the fear that their accented speech or use of incorrect or imprecise language will worsen language impairments. However, while bilingual children may show mild, isolated delays relatively to monolingual children in a single language skill such as vocabulary and verbal fluency, these reductions are often not clinically significant. Typical development and autism spectrum disorder research alike indicates that bilingualism is not harmful to development across domains such as overall cognitive skills, executive functioning, and social development. Another obstacle in bilingual families is the feeling that they must implement interventions in the majority language due to the lack of non-majority language services in the United States. An example of why parents may feel like they must implement interventions in the majority language is by the information and interactions being in the majority language. In a U.S.-based study, Jigastistan 2010 found that English-based information pamphlets and medical appointments left parents in the linguistic minority feeling helpless, confused, uncertain of their child's diagnosis, and unsure of the best treatment course, regardless of the education level and English proficiency. The success maintained of two languages is complex even in the absence of ASD. Raising a child bilingually relies heavily on early and persistent exposure to and continuous support for both languages, which can be largely undertaken for bilingual families. I've listed some guidelines/recommendations that can help when working with bilingual families. According to Wang, one recommendation is to encourage and support bilingual exposure in the home. This can help increase a level of trust and respect with the families. Providing translated information, adequate interpretations, and culturally competent support. This includes translated pamphlets and documents. Professionals must stay informed on literature related to bilingual developments. For example, families may inquire about utilizing both majority and heritage language, and literature can help guide to maintain a balance. Encourage professionals to advise on ASD in a way that is culturally responsive rather than requiring families to assimilate to the majority culture. Professional settings are encouraged to implement culture trainings, lectures, and discussions to bring awareness to cultural factors and keep staff informed on current literature that impacts their clientele. Urban versus rural populations. Rural areas are typically in the country areas and have fewer than 2,500 residents. They consist of small towns and counties, whereas urban areas are big cities and areas that have densely settled areas around them. Although many parents of children with ASD find it difficult to access quality services, greater challenges may be experienced by families in rural areas. Rural parents report decreased access to services, and the services themselves were considered to be less effective. Trouble accessing trained professionals and accessing services overall. But the task of finding trained professionals and physicians was significantly more difficult for rural families. This adds a burden to rural families because they need to travel further distances and for longer time to get quality services. When behavior support services are recommended to parents, the rural families were less likely to implement behavior supports at home, citing that it was not available in their area. If families are getting recommendations to things that are not available in their area, families are not likely going to want to hear any other recommendations or not trust the professional to truly help their unique family needs. Another important factor in urban versus rural population is the significant differences observed in age at diagnosis of autism between different socioeconomic and geographic classes. Growing evidence emphasizes the importance of early detection and intervention, which can significantly affect a child's well-being and reduce family and community burden. Children in rural areas are believed to be more likely to receive a delayed diagnosis of autism. Moreover, geographic disparities in access to healthcare services seem to make parents experience a lengthier diagnosis process. I've listed some guidelines/recommendations that can help when working with urban and rural populations. As the number of children diagnosed with ASD rises, it becomes increasingly important to understand their services needs, especially in rural areas that have low accessibility to services and trained professions, meaning that one will identify resources around their specific area. Provide parent support services are necessary to help them cope and understand. There's also online workshops and training sessions for professional developments, so families don't have to travel a long distance to attend workshops and training sessions. Online web conferences software to increase participation. Socioeconomic status. Socioeconomic status is made up of several different factors. Among those factors are an individual's income level, education level, family background, ethnicity, and religion. Parental SES is a composite variable based on the mother and or the father's professional background, as well as family dynamics, including families where parents were both working, both parents with one parent working, or being a single parent where you are working. A person's socioeconomic status can control other things in life, such as access to resources, access to levels of treatments, and access to better schools. In higher SES areas, children with developmental delays or perceived behavioral problems may come under scrutiny earlier than children in lower SES areas due to greater resources available in wealthier school districts and/or greater awareness by parents and teachers. Studies in the United States have found lower rates of autism diagnosis associated with lower socioeconomic status, according to Kelly in 2017. Lower rates of autism diagnosis was also seen with rural populations. More highly educated parents might also be more likely to demand evaluations of a child not meeting expected standards. A study done in the United Kingdom found that children whose mothers were educated to an A level or above being around twice as likely to have a diagnosis of autism compared to children of mothers educated to below A level. Minority race ethnicities has also been associated with later age of diagnosis. Minority children are more likely to live in poorer areas, and later age at diagnosis could result in lower prevalence of certainty at age 8. I've listed some guidelines and recommendations that can help when working with different socioeconomic status families. One is to increase education. This can be done by having free classes, resources to educate parents about children's milestones. Also, increase awareness of autism to low-income families. As mentioned previously, socioeconomic status was associated to early diagnosis. Being able to explain the usefulness of screening programs can help close the gap of ageist diagnosis and increase early interventions, as well as supplying or providing more accessible support services, meaning that staff will give services that may be covered by insurance or other financial help. Military families. Military families with a child with ASD experiences challenges associated with both the military lifestyle and having a child with special needs. In general, they have frequent relocations and separation as stressors unique to military families. Military families relocate, or PCS, permanent change of station, approximately 3 times as often as non-military families. For example, the family may feel stressed because of the potential loss or change in their social support system, and children may display more behavioral problems as they adjust to their new environment. One of the DSM-5 is insistence of sameness, inflexible adherence to routines or ritualized patterns, or verbal nonverbal behavior, which includes difficulties with transitions, which is why children may display more behavioral problems as they adjust to their new environment. Another stressor specific to military families is extended separations of military service member from the rest of the family unit. These separations can be result of deployments and or military trainings. During deployments or other military-related separations, the child and family members remain at home may feel increased stress associated with the role shifts as the family adjusts to the military service member's absence. I've listed some guidelines recommendations that can help when working with military families. 1. Staff should be aware of the resources specific to military family members, such as the Family Readiness System, a system of service and programs for military families for coping with deployment, relocation, and other military concerns. Military families with children with special needs are able to enroll in special education services offered by DODEA. This includes type of schools and daycares. When recommending services, it is important to understand the insurance benefits under the Extended Healthcare Options, ECHO, through the Military Insurance TRICARE. Also, when making recommendations of treatments and intervention, consider being flexible and having attainable ones if they are going to be separated or relocating. Diversity. A diversity or family factor can have effects, diagnosis, access to treatment, or other outcome for an individual with autism. It is our job to continue to increase our cultural competence to better help the clients and families we work with. References. Here you can find all the resources I used for this presentation. Thank you.